What I like to tell students that are considering applying to our family medicine program here at CMU is that upon graduation, you'll find yourself in a position where you will not falter at any step along the way of treating patients, which is really what we're preparing you for throughout your training here for the 3 years. You'll find yourself in a position where you're comfortable handling any situation, any patient load.
Being that I'm family medicine, I wanted training where I could get a lot of hands-on experience, where I didn't have to compete with a ton of other residency programs in order to have time to work with specialists or to have time to do procedures. I really wanted a program where I would get a ton of experience, and then I also wanted a variety in my patient populations.
What does set us apart is that given that we're kind of at the northern end of a dense population here in Michigan, we find ourselves being the focus for like the catchment area for mid-Michigan to North Michigan. And what that allows us to do is to present to our residents cases that they probably won't get to see anywhere else.
Most of our residents come from a really diverse background. They don't take the traditional path to medicine. So we have people that have gone through physical therapy, that have gone through other residencies, pathology, surgery, and I think that makes for a really well-rounded program. As a whole, CMU really has a drive to make Saginaw a better, healthier, more beautiful place, and I think that's great, and I want to be a part of it. And it's actually one of the reasons why I signed on as faculty after residency as well.
What we want to ensure is that their education has provided them a base where they go out into the field and they can choose the path they want to follow for their personal growth, for their family's growth. And they won't ever look back and think, hey, you know what? I didn't learn that in residency.